Okay, here's the humerus. In this section, we're going to go over humerus, radius, and ulna. Okay, the greater tubercle would be right here, and this is the lesser tubercle. So let's click the bone and then isolate it. Alright, greater and lesser tubercle. And then you can see that this bump is bigger, so there's the greater, and then there's the lesser. And the intertubercular sulcus is here. That's also where the bicep tendon is going to rest itself. We'll look at the bicep stuff when we get to muscle. The head of the humerus, there. Okay, the radial groove. Now this is an anterior view of the humerus. Turning it, there's your posterior view, and the radial groove is here. It's where the radial nerve would rest. As it's traveling down the arm. Deltoid tuberosity. So let's turn this to a lateral view. Well, let me get a good view for you here. Deltoid tuberosity. There's a bump. It's in this area. So the deltoid muscle, which takes up a lot of the shoulder muscle here, comes down and inserts itself about this area, the deltoid tuberosity. Okay, the olecranon fossa. So there's your anterior view, there's your posterior view. The olecranon fossa is in here. So it's a divot, a fossa to allow the hinge joint. Once you connect the ulna here, it allows for room for that hinge joint to move. Okay, the medial epicondyle. So let's go back to our anterior view. The medial epicondyle is this bump here, and if you compare it to the lateral epicondyle, the medial epicondyle is more prominent, it's bigger. One way you can orient yourself, medial and lateral, as you're trying to identify right versus left humerus. Okay, now adding the skeleton here, just to give you a reference point, you can see that, here's our midline, and then this points medially. This is a right humerus, anterior view. Okay, the trochlea is this part here where the ulna articulates, and the capitulum is the round part. Now one way you can remember that is kind of has the word pitch in it, the capitulum. So a baseball pitcher pitches a ball. This kind of looks like a ball. Now watch this. When you add the radius, it kind of looks like a bat, a baseball bat, with that distinct end that you would hold. So capitulum, and there's the radius, and this side is the trochlea, where the ulna attaches itself to. Okay, the radial bone. Let's go back for a full view. So there's your radial bone. It is always on the thumb side. Okay, always on the thumb side. And we have the head of the radius, which is here. Let me isolate it, zoom in. Okay, so there's the head of the radius. And this is the neck. That part's the neck. And the radial tuberosity, which is this bump right here. Radial tuberosity. Let's turn it. You can see more of the bump there, radial tuberosity. And then the styloid process, which is at the distal end, right there. Styloid process. Okay, the ulna, which is this bone here, this is going to always be on the pinky side, the ulna. Okay, let's isolate it. And we have the olecranon process, which is here. It's where the tricep tendon will insert. So the olecranon process, or the elbow. Trochlear notch. It's this area. Okay, trochlear notch. Interosseous membrane. Okay, so let's add the connective tissue part and then zoom in. Here's the interosseous membrane. Inter, in between, osseous, bone, and it's a membrane. This is considered a joint in certain people that accept that in the sports medicine, human biomechanics, kinesiology world. When you do supination and pronation, the radial head moves and pivots. The radial bone rolls over the ulna, which allows for that joint to move, this entire length to move. Okay, a lot of people and therapists do not treat interosseous membrane stuff, but it's a really, really good structure to rehab should there be like an elbow, arm, or wrist injury. Okay, the head of the ulna. Okay, the head of the ulna is at the distal end. Okay, down here. So the radius and ulna heads are opposite. The radial head is at the proximal end. Okay, here. Radial head at the proximal end. And the head of the ulna at the distal end. Okay, and there's the styloid process of the ulna. Right there. Styloid process of ulna.